Hey, this is Doctr Night Class. Go ahead and click like and subscribe below. Hope you enjoy the medical content.
So the testes, we have clinical scenarios of the testes. You have a hydrocele. Hydrocele. Now, guys, please know this because they may word the answer just like this. How does a hydrocele happen? It's the presence of fluid in persistence of a process vaginalis. That is test questionable, guys. Okay, so the process vaginalis is an external layer to the testes. It's an external layer. Okay, external layer. Now it's a persistent. It says persistent, which means something in embryology was supposed to obliterate. It was supposed to disappear, right? Because in embryology, there's three flavors. It's either a failure of apoptosis, a failure of mitosis, which is to divide, or a failure to migrate. Well, there's no problem with mitosis here dividing because we only need one of these, and we have one. There's no problem with migration because everything's where it's supposed to be. What happens is there's a persistence, which means something was supposed to disappear. So it's a failure of apoptosis. And what happens is you have this fluid collect, you have this fluid build up in the tunica vaginalis. Okay, it's right here. But what is this fluid? Is it blood? No, it's not blood. It's not blood. And that's what we need to know. So a hydrocele is likely something like plasma. Okay, maybe it's interstitial fluid, but it's clear, is what I'm trying to say. It's clear. All right. And how do we know that? We take a flashlight and we shine it through the testes. And if light passes through the hydrocele into the other side, we know it's a hydrocele. Okay, we know it's a hydrocele. All right, so here, the other flavor, actually, we have one more. We have one more. What would be a hematocele? A hematocele is basically, excuse me, I'm sorry. So sorry. I have the fan blowing, drying out my throat. All right, let's go. So, a hematocele is blood occupying the same space. Okay, this is much less common, much less common. Okay, but if you shine light through a hematocele, it's probably not going to go through as well because blood has components to it. It has things like red blood cells, okay, that have heme and hemoglobin. Okay, so it's harder to pass light through blood than it is through plasma or filtrate or interstitial fluid or even water. Okay, so this one's less common. You don't have to worry about that one too much. But a varicocele is common. We've mentioned it already, a varicocele. It has to do with that sharp 90-degree angle, which slows down the blood flow, the venous return into the inferior vena cava. It slows it down. So there's more blood in the left gonadal vein and leads to the bag of worms. Does this look like a bag of worms? I think so. So the left testy, it's more common to happen over there because of this angle. The left gonadal vein drains into the left renal vein. There's a sharp angle. The right gonadal vein doesn't have that problem. The right gonadal vein drains right into the IVC. Okay, nice, smooth transition, like pulling onto a highway. Nice and smooth. This is the exit ramp on a highway. But over here, this is like stopping at a stop sign, putting your blinker on, letting the old lady cross the street, right? And letting the Boy Scout walk the old lady across the street. You're sitting at a traffic light here. And then you can make a left turn. Okay? Then you can make a left turn. But that delay keeps more blood in the left gonadal vein. You'll see this here, this varicocele engorgement of the pampiform plexus. You need to know that, guys. That is highly, highly test questionable. Highly test questionable. And how do we correlate that to physiology, I said if there's a lot of blood collecting in an area, it's going to bring a lot of warmth. It's going to be warm, and that's not good for the testicles. Okay, so the result is you have a low sperm count. The Sertoli cells, it's like you got to set the mood for them. They like it nice and cold. Okay, they need a cold shower. Okay, Sertoli cells like it nice and cold. All right, great. The last thing for this, as I mentioned, with the hematocele, light doesn't shine through that blood. It's too thick. It's viscous. Okay, so what is dilating these pampiform plexuses? Since it's a vein, it's blood. Blood is filling up. So what do? A quick exam. Take the patient in the room, turn off the light, right? Keep the door cracked open so they don't file you for sexual harassment. Keep the door cracked open, turn off the light, take a flashlight, shine it on their left testicle. If light does not go through, you have a pampiform plexus that's dilated. That's a varicocele. Okay? Or if light goes through, you have a hydrocele. Pretty good stuff, right? After you do that, you got to figure out how to bill insurance, because this can be done at home. That could be done at home.
For more night class content, go ahead and email me at drnightclass@gmail.com. That's DOCTR nightclass@gmail.com. Hope you enjoy the content.